Hello, this video is part 1 in Dr. Pinky's video resources, which are designed to introduce medical students to basic mental health assessment topics. They aim to be a learning resource to improve your clinical skills. They may not tell you everything you need to know, but will give you a good idea of what to expect and can be used alongside other resources to further your learning. This video, Video 1, is designed to help you with taking a history about depression. Depression is common and can affect patients in many different ways, so you need to have a good idea of the questions you need to ask to be able to diagnose it effectively. Firstly, as always, you must introduce yourself and identify the patient. Let's start. Hello, I am Dr. Pinky. Can I check your name and date of birth, please?
Yes, my name is Mrs. Snuffles, and my date of birth is the 21st of July 1988.
Thank you. Now gain consent to take the history. Is it okay if I ask you a few questions about how you have been feeling recently?
Yes, that is okay with me.
Okay, if you are screening a patient for depression, there are 2 important questions to ask to begin with. Firstly, during the last month, have you often been bothered by feeling down, depressed, or hopeless?
Yes, I suppose I have.
And during the last month, have you often been bothered by having little interest or pleasure in doing things?
Yes, I have noticed that too.
An answer of yes to either of the previous questions is suggestive of depression. However, it is important to remember that an answer of no does not exclude depression. At this point, you should ask about persistent key symptoms the patient may be experiencing. Ask if the patient feels down all the time. You can adapt Socrates to suit this, and ask about timings, associated symptoms, things that make the depression worse or better.
When you have asked that, you should ask what are the triggers for the depression? Establish if there are precipitating or perpetuating factors that influence the depression. That is to say, what made them feel down in the first place? Are there things that regularly make them feel down?
That is a good idea. You should ask about that. Also, it is important to know how long the patient has been experiencing symptoms. Over 2 weeks is usually said to be clinically significant. Ask the patient how their sleep is. Sleep can often be disturbed when a person is depressed. Does the patient have trouble getting to sleep, or do they wake earlier than usual? Ask the patient if they are easily irritable. This is also common in depressed patients. You can also ask about fatigue. Patients with depression often feel more tired than usual. Have you been feeling more tired than normal?
Yes, I have been feeling very tired for 2 weeks and 1 day.
How are your energy levels?
They have not been great. In addition to feeling tired, I have had little energy to do things.
At this point, we are going to explore loss of interests or pleasure in doing things. This is known as anhedonia and can affect patients in many different ways, and so it is important to ask about changes in engagement and participation in social activities.
I suppose I can't be bothered to go and play tennis as much as I used to before I felt like this.
Also ask about how things are at work and if it is affecting their social life. How is the depression affecting their day-to-day life? Has their concentration, appetite, weight or libido been affected?
I am feeling stressed at work, like many patients who feel depressed. I have also noticed I see my friends less.
Finally, ask if the patient has started drinking or recreational drug use. Your patient may already have a history of drinking or recreational drug use. In this case, ask if those problems have got worse recently. You may have to look more closely at their alcohol consumption, but that will be covered in another video. In addition, you may feel like you want to assess any ideas of self-harm or suicide the patient may present. This will also be covered in another video, Video 2 of this series. In addition to these questions about depression, it is important to ask the other questions you would ask normally in a history to get a full picture of the patient. This ensures nothing is missed, and that any management plan is created in the patient's best interests.
Thank you for using this resource. I hope you found it helpful. Don't forget to check out the other mental health video resources in this series. Goodbye.